How to bring soaring syphilis rates down. An expert in sexual health weighs in about the role technology is playing. Also, how public health officials trace who has been exposed to an infection during an outbreak. I'm Affan Chowdhry. Welcome to Globe Now. Syphilis is a sexually transmitted infection, and in Winnipeg, it's a problem, a big problem. The city is witnessing its worst outbreak in years. It's not contained to just Manitoba. Over the summer, public health officials in Vancouver sent a stark message. If you're sexually active, and especially if you're a gay man, you are at risk. Add into the mix the prevalence of hookup sites like Tinder, Grindr, and Squirt, which facilitate sexual encounters. Well, you can see why public health officials are worried. So, what is the connection between technology and the rise of sexually transmitted infections? Let's go to Los Angeles and talk to Matthew Beymer. He's an epidemiologist, and earlier this year, he investigated the link between hookup sites and disease. He works in the LGBT Center in Los Angeles. Hi, Matthew.
Hello.
What was the big discovery in your study?
The big discovery in our study is that we were able to find that individuals who are using hookup sites like Grindr, Scruff, Recon, and Jacked had a higher incidence of gonorrhea and chlamydia when compared to individuals who just use the internet to find partners or who just met partners in person.
And you know, how confident are you that those hookup sites and technology facilitated that?
We're very confident. One of the things that we think about in science when we're doing studies is how many people were asked our particular questionnaire. And in this instance, we asked 7,000 people this questionnaire over a period of a year and a half. So we definitely have the data we need to make a determination like this.
I mean, it sounds like it's technology's fault, but you know, syphilis is an old infection. It's something that public health officials have struggled for a long, long time. Is it really technology's fault?
I really don't think so. I mean, what we have to really look at when we compare these different media are the efficiency standards. So, for instance, if an individual is meeting other individuals at a bar on a given evening, they're more likely to just go home with one individual. Whereas if they're using a phone app, which actually has GPS enabled on the phone, they're able to have multiple sexual partners in a day because these apps sort by the relative location to the initial user. So we really don't think it's about technology as much as it is an increase in efficiency. I don't think that, again, technology is to blame here. It's just technology has certain benefits and it also carries certain risks.
So what responsibility then is there among the technology creators, the apps, the sites, in terms of a role perhaps in public health and curbing these incidences?
The LGBT community is very small, and because it's so small, it's very communal and it has a lot of social obligation. And I think that apps are really going to distinguish themselves from other apps if they incorporate health messages into their campaigns, if they allow users to post their STD and HIV results, and if they remind individuals periodically of the risk of unprotected sex and where they can get tested most closely to their relative location.
And Matthew, is that actually happening? Are apps and sites doing that?
We have seen one example so far. There's an app called Mister, which partnered with a testing app called Hula, where you can go to a medical clinic, you can get your HIV and STD test results and upload it to the app. And what happens is Mister takes the information from Hula and posts it on your profile, so that way the person can see how recently you've been tested and if you're HIV positive or not. So we are slowly seeing a shift towards that direction. But really what we need to do in the public health world is create tools which these other companies can then take on and use in their apps.
I mean, in talking about syphilis rates and hookups, the suggestion is that this is happening largely in the LGBT community. Is that a fair representation?
I think it is a fair representation, and it's really just a numbers game in the sense that there are a lot fewer LGBT individuals in the United States and around the world. And because there are fewer individuals to have sexual contact with. So if you have one individual who has syphilis in the LGBT community, they have a much higher probability of transmitting that to another individual versus the straight community in which there's a much larger representation.
I mean, we've talked a lot about the role of technology, and with that in mind, I wonder what is the biggest challenge in bringing the rate of sexually transmitted infections down?
I think the biggest challenge really is to reduce the stigma that comes with HIV and STD testing and actually having that conversation. What we really want to do at the Los Angeles LGBT Center and many of our sister organizations around the world would like to do is really empower LGBT people about their health and make sure that they know that it's okay to have a conversation. And the way we do that is giving them information, allowing them to see that their STD and HIV results, and really giving them the best tools that they can have in order to make the safest sexual decisions.
Okay, Matthew Beymer, thank you so much.
Thank you.
Well, we want to hear from you. What role do you think technology plays, and is it the culprit in the rise of some sexually transmitted infections? Tweet us at Globe Now. So one of the things that happens during a spike in an infection like syphilis is contact tracing, and it's done by public health officials. It's key to containing an outbreak, whether it's syphilis or Ebola. But what exactly is it, and how does it work?
Contact tracing is sort of like detective work. It's about figuring out what the person did in the time that they were infectious, who they may have been in contact with, who they may have spread their infection to, and then finding those people and offering them interventions or strategies or counseling depending on the disease that we're following up. We would usually get that information from the laboratory that somebody has a sexually transmitted infection. Then the public health nurse would phone that person and go over their sexual history. And then they would negotiate whether that person wants to notify their sexual partners on their own or whether they want the assistance of the public health nurse to notify their contacts. They would never give the name of the person who actually had the sexually transmitted infection because confidentiality is really important. The biggest challenge with contact tracing is getting a good story, trying to figure out exactly where the person has been and who they may have been with. Sometimes people don't remember. Sometimes people will remember a few days later, oh yeah, I forgot to tell you about this. Sometimes the person can be very sick and they may not be able to give you a story, and that poses its own challenges.
That's all for today's show. If you've got a moment, hop onto Twitter and tell us what you thought about today's program. Tweet us at Globe Now. I'm Affan Chowdhry. Thanks for watching.